12:35, so I think we're ready to get going here. Babs, you ready to get us rolling? All right, so we're so happy today to welcome Angelica Sadar, who is here today to talk to us about a very important topic, something that really needs to be used more widely with people with IDD, I think, called neurofeedback. And so her presentation today is about whether can neurofeedback help IDD. And so we're going to get to her in just a moment. We're going to just talk a little bit about our upcoming schedule. Next week, we have Mickey Tonis, who's going to talk to us about some ethical issues in IDD. On March 14th, we have Patrice Coleman, who is going to be here from the Nashville Department of Emergency Communications to talk to us about rapid SOS. And then on March 21st, we have John Quill Newland from Tennessee Commission on Children and Youth. He'll be here to talk to us. And then on March 28th, we have a special guest, Dan Baker, who will be with us. Dan Baker, former president of NAD, now past president of NAD, but also author of several books, who will be with us to talk about his work. And we've been trying to get him for a while. I was thinking about this, Juanita. I guess what you have to end up doing is marrying a guy to recruit him to be on the show.
That's my commitment to NAD. I got to tell you, like, I'll do anything for NAD.
That shows a strong commitment right there. But really got a great schedule coming up. I hope everybody will be able to join us for all of those. Mm-hmm. So let's see here. I think we've already met our co-host, Juanita St. Croix, here with us. Also myself, Dr. Bruce Davis. Babs Tierno is our producer. And today's speaker, Angelica Sadar.
So we are going to break from our tradition of how we do our introductions today, and I have the great pleasure of introducing Angelica right now. Before we do our Smarticle, which is my geeky favorite part of this consultation network. So Angelica is a licensed psychologist who's board certified in neurofeedback and heart rate variability, and is a BCIA approved mentor of neurofeedback. She has been in private practice in the greater Philadelphia area since 1985. Her work over the years has involved all age groups and clinical presentations. She is a treatment coordinator at Sadar Psychological and is nationally and internationally, I added internationally, given the number of times that Angelica has kindly presented at our conferences for NAD as well. And she provides education, she provides speaking sessions and training sessions on education and offering training to other professionals in neurofeedback, biofeedback, and hypnosis. In 2018, Angelica was invited to be part of Brain Arc Switzerland and began developing evaluation protocols based on research of HBI Med Switzerland. Presently, her clinical focus is on patients with complex and comorbid presentations and consulting other psychologists, medical practitioners, and other clinicians regarding EEG, neurofeedback, and practice development. She is the executive director of the Northeast Region Biofeedback Society and a member at large of the Association of Applied Psychophysiological and Biofeedback. That was a mouthful. So please welcome Angelica. And to get her started, I will introduce the Get Smarticle. Love this part. So today's Get Smarticle is an article provided by Angelica, which was Neurofeedback for Education of Children with ADHD and Specific Learning Disorders, a review. I've got the citation there for you if you'd like to look it up. I didn't do the in-depth piece of the outcomes regarding education and learning disorders. I took it as an opportunity to do neurofeedback You know that book for dummies, that series of books? I don't really like the title, but if you take it down even a notch from dummies to my level of understanding of neurofeedback prior to this, that's where we're talking. So I'm giving truly a very basic piece that came from the article about how neurofeedback works or the processes of neurofeedback. And I'm confident Angelica will clarify whatever I say after I finish. So, what is neurofeedback? It's a type of biofeedback in which the individual's brain activity is measured and presented to them to support self regulation and ongoing brain oscillations and achieve specific behavioral and neurophysiological outcomes. Said it right. Thank you. So, the goal of the identified article, as explained by the authors, is to provide the best learning environment for children with ADHD and other learning disorders. It is critical to better understand the role of neurofeedback in educational settings. The findings of the article were they need to do more research in the area, and that certainly enhanced use of neurofeedback in educational settings would be a high positive. So we'll go on with our little lesson. So a few things to know: brain is constantly active. I believe we all know that. See, when we're awake and when we're asleep, the brain is active. Neurofeedback methods are based on functional magnetic resonance imaging, fMRI, or near infrared spectroscopy, which is NIRS, or EEG-NF, that's electroencephalogram neurofeedback. EEG is the primary method used, although quite often it's mixed use among the other methodologies and EEG, mainly because it's lower cost than the other two, and it's easier to use and it's less invasive. What I found to be very interesting facts, I will get to in a minute. But right now, measuring brain activity. Neurofeedback uses EEG-NF to reflect brain activity, which is reported as waves with different frequencies. And this is taking you back to high school physics, I think. Waves have frequencies which are measured bandwidth from point to point on the wave. I was shocked I could remember that, but I always liked physics. So through the EEG, the frequencies are then sorted as bands, and each frequency band represents a different brain activity. These are the geeky little facts, and I've added a little table if anybody wants the PowerPoint because they are like me and love this kind of information. It's all in both the article and the PowerPoint if you want it. So frequency bands are correlated with various degrees of neuronal synchronizations and are also linked to the variety of cognitive operations, such as a delta wave, which is a certain frequency, is associated with inhibition of sensory afferents. Theta waves, typical of nervousness, and on and on. So each band or wave band is associated with a different cognitive process. I want to go ahead. This is the chart that I absolutely had to copy from the article. I was compelled to do so. We can skip it. It's the same information. Thanks. How does the process work? So there are 5 separate components to neurofeedback. I'm not going to go over the first 3. I will go to the 4th, which is the continuous audio video feedback piece, which presents the brain activity to the participant while they perform a task. This is so simplified, isn't it, Angelica? Like
it's not that complex. It's the equipment that lets us be complex, but
fair enough.
the process itself.
Fair enough.
You're doing great. Yeah.
So the feedback to the participant can be audio, visual, or a combination, as intended to help participants modulate their own brain activity to complete the task and then obtain a reward. I want to go ahead. How does the process work? With the final component, so the 5th component of the neurofeedback systems is the participant's performance, which determines the success or failure of the training. The difficulty of the task can be altered according to how easy the participant can perform the task. Applications in recent years, it's been used for several neuropsychiatric conditions, including ADHD, hyperactivity disorder, epilepsy, migraine, headaches. It also has very practical implications for neurodevelopmental disorders, which is what Angelica will be talking about as we go forward. The empirical evidence of efficacy is still being collected. I think it's very positive so far from what I'm reading, that empirical evidence indicates the beneficial use of neurofeedback for people with IDD. I'm going to go ahead. Angelica has provided a different resource as well, which is a more layman's term type of article, and also incredibly useful: Disabilities and Differences, Neurofeedback, a Promising Theory for Developmental Disabilities. And there's the link for it. It's through Cars for Kids. And then that brings us to Angelica. How could neurofeedback impact treatment for people who have an IDD? That's the focus of our session today. Please join me in welcoming Angelica. We are so happy to have her here today. And Angelica is going to share a little known fact about herself.
I said, I'm from New York. New Yorkers just talk. And even when they don't need to talk. But I guess what's not well known is I'm actually from Germany. And so I am a military product of World War II, post-World War II. And my entire family came over from Germany. So I grew up in a German-speaking household, didn't know how to say a lot of the American words for a long time because the Germans say them different. Mm-hmm. And to that end, I guess, that was kind of like I was the brunt of a lot of jokes in school without realizing it. At that time, we didn't even call it bullying. It wasn't bullying. It made you tough. And it was like, yeah, the kids make fun of me because of the way I talk. But that's how everybody talks in my house. So that's the little known fact.
That is very interesting.
And you all settled in Pennsylvania? Is that where your family settled? Or
no, we actually, my whole family is on Long Island. Everybody from Germany. There's nobody left in Germany. And then because of schooling, kind of a circuitous route, which I can go into, actually ended up in Ohio for graduate school. And then from there, my husband continued graduate school. We went to Nebraska. And in Nebraska, I was really lucky. I got a cool job where we were working in the homes with folks with disabilities. So I did a lot of driving, had a motorcycle. That's another little known fact. I used to ride a motorcycle.
That's a great fact. You're a plethora of facts.
Didn't think of that one. When you're, roads are a mile apart in Nebraska. There's no traffic. So anyway, we traveled to houses and visit with people, and then came back here, and I worked at the state developmental facility, at Norristown State Hospital, so the state psychiatric facility, and then ultimately got into private practice and neurofeedback.
So happy you could be here today to talk to us about this really important topic.
Mm-hmm. Wonderful. Thank you so much.
We'll let you launch right in here, Angelica.
All right. I have kind of a PowerPoint because I'm a visual person. So I can do that. I can pull that up, or I can just look at it myself and talk. Which can I share? So what do I do? I have never used this platform before. All the platforms. Do I go into here? Yep.
It says share. You can click share either at the top or at the bottom.
I'll share my screen. That's fine.
Yeah.
Oh, I can. Let's see. I don't really. Yeah, okay, see if that works.
There you go. Yeah, you got it up there.
All right. Oh, those are some pictures. That's a road I took to get to somebody's house in Nebraska, Norristown State Hospital now. They're actually going to put condos up there before long. Anyway, so neurofeedback is a loop, right? It's an information loop. And so if we start with the client, we put sensors on their head, And the sensors read. All they do is read. They never put anything in. And that's really important when we're working with people that, have IDD, and everybody really, nobody wants it put in, but we really want to show people this is something that's not harmless. It's not going to be done to you. We get those readings and it gets projected onto a screen in the brainwaves, as Juanita showed us. And then that gets translated through the software. And that's the complex thing out of all of this. I mean, the brain's complex, but the person doing the neurofeedback and the person that's receiving the neurofeedback, it's pretty simple. I'm going to show you how simple it is. But through the software, the data gets processed into the waves, and then it goes on to a monitor where the client gets the visual and auditory feedback. That's what it looks like in the office. Okay, so the therapist screen has the brainwaves and the client screen has a picture. In this case, you can't see it very clearly, but he's like watching somebody on a jet ski. And when his brainwaves are doing more of what we want them to do, the jet ski goes and jumps over the ramp and does all kinds of tricks and things like that. So I think of neurofeedback never as a standalone. It's something that's an adjunct. It's another way to help somebody. It's just another way to give them information. And we kind of know about that. We've gotten into relaxation techniques, right? We started out with psychotherapy, didactic training, CBT, and then we also added other things like physical interventions. But what I like to think about is, who are we? We have lots of components. So we have, let's start off with our intelligence, our intellectual abilities, but sometimes we can't access them, okay? And that impairs our success. So we have our soul, and it might be we might be somebody who really has a lot of resilience, a lot of drive, but because of the way our brain is working, we can't access the other attributes of ourself. And that's really why we like neurofeedback. It enables us to access more of who we are. Years ago, when neurofeedback was new, and it's still pretty new, but it's way older than a lot of medications, by the way. But people still don't know what it is. And I actually did a kind of an experiment. I was traveling and I had lots of flight transfers and I was in the airport a lot. And I said, every place I sit, I'm just going to ask the person to the left and right of me, have you ever heard of neurofeedback? Probably crossed about 20 or more people on that trip, and not one person ever heard of neurofeedback. So even though it's not so new, it's not so well known. And so a group of providers, we sat around and we were like, how do you describe it to somebody very succinctly? It's physical therapy for the brain. It's just retraining the brain so the brain can work more efficiently. Easy. So, before I get into IDD, I want to talk about the reason I'm here is because of a partnership that the Northeast Region Biofeedback Society has formed with NAD. And it's been a very rewarding partnership. We've been working with each other, helping educate each other. So I want to, pay my respects to that and to the fact that I'm even here today. And so we all know IDD is a brain issue, right? And what is it? What happens in the brain? When I work with somebody now, very differently than how I worked with them 20 years ago, I'm really interested in, what was your mother's prenatal health? What do you know about that, if anything? What do we know about your birth, if anything? Can't tell you how many people say everything was fine, but the cord was wrapped around their neck at birth and they were in the NICU for 2 weeks, but they were fine. Like, no, that's not exactly fine. Thank God that the baby survived. And thank God the doctor didn't say to the mother, we got to worry about this, might be a problem in the future. Okay. Everybody wants to have the best environment at that time, but we do want to watch out what happens with those kinds of things. What happens then when the brain's not connecting well, when it's not talking with itself? What happens with oxygen deprivation? Okay. What happens if we have verbal limitations? Anymore, I don't really think in terms of diagnoses. It doesn't matter to me what DSM category you're in. I think in terms of what happened to your brain and what can we do to help make it work more efficiently. When we have IDD, we all know that then we run into many events that build up our exposure to trauma. And we also know that trauma changes the way the brain works. There is the element of resilience, and not everybody exposed to the same type of trauma will have the same impact. Okay, there are clearly those that are more resilient, but we do know it changes the way the brain works. It activates different portions of the brain. People who are exposed to trauma, and many of them with IDD do get exposed to trauma, then what happens is their brain stays in a high level of alertness. Their fight and flight reflex is turned on all the time. Okay, and one of the things with trauma is we don't want people to talk about their trauma over and over. All that does is kind of hammer down the path, make it stronger in their brain, and make it harder to get past it. So from that point of view, neurofeedback is very, very appealing. Okay, they don't have to talk about it again. Okay, and it supplements other tools. It's not a standalone. It works nicely with all the other methods that we use. So neurofeedback is a form of biofeedback, and we've all done biofeedback. Okay, this is a picture of somebody taking their peripheral temperature, but we've all taken our temperature, whether it's on our forehead, in our ears, in our mouth, whatever. You take your temperature and you say, it's 101. I guess I am sick. I think I'll go to bed. I'm going to have some chicken soup, and then in a while I'll take my temperature again. Biofeedback. I got information about my biology, about my physiology. And then based on that new information, I may make a change again. So we can actually take the temperature of your peripheral physiology, your finger, your blood flow, and measure that. That is related to your fight or flight index. So how does it even work, right? We measure the electrical activity in the brain, we show it to the client, and we let the client learn how to improve the efficiency of their brain. Sometimes I'll tell people this and they're like, I don't get it. Okay, how does a baby learn to walk? Nobody says to the baby, today's the day, you're going to learn to walk. I'm going to teach you how to do it. You push on your calves, you raise your butt. Nobody says that. The baby figures it out. And as they fall, they figure it out more. They get feedback. Okay? And the adult around the baby helps them. The adult doesn't show them every minute what to do. The adult watches them. If they start to get in danger, they help them. They step in for a moment. That's how neurofeedback works. That's a little bit about the history. I can share this with you and you guys can go over it. And Juanita, thank you. You did all of that. This is what the brain waves look like. And this is an example of what we look at. Okay, you can see here's a bunch of brain waves. And now these don't look like these. Okay, And that tells us something. It's almost like reading a different language. So, why don't more people do it? I don't know. I don't know. I think, I can talk about the politics behind it, but I can tell you why more people should do it. It's cost effective. Okay, there is the initial outlay of learning it, and there's the initial outlay of purchasing the equipment. And to be honest with you, that's going to cost probably around $15,000. Okay, but then you can start working with more patients. And I hear from therapists all the time, they just don't burn out as readily. They can see more patients in a day, and their patients improve. So the job satisfaction improves. And do you know, once the brain learns how to do something efficiently, it wants to do it. It wants to do things right. So once the neurofeedback has become a part of what that brain has learned to do, it keeps it by and large for a long time.
Angelica, let me ask a quick question about the 15,000 that you were talking about. So you said that was a combination of equipment and training that you would need to be able to operate it correctly. What proportion of that is the equipment versus the training that you're getting?
Equipment runs about $8,000 to $10,000, and you can buy it like on rental systems, like Rent to Buy and things like that, or you can just rent ongoing.
Okay, very good. Thank you.
Mm-hmm. Okay, so there's a lot of confusion in the field. People call interchangeably, they use terms biofeedback, neurofeedback. So this is just to kind of show you neurofeedback falls under the broad umbrella of biofeedback. And I see that got cut off, but there are 3 different types of neurofeedback that are listed there. And that's not really relevant for what we're talking about anyway. So different types of neurofeedback. And then there's peripheral biofeedback, which would be temperature training, galvanic skin response, like you're sweating, okay? EMG, muscle tension, heart rate variability. That's a combination of the rhythm of your breathing and the rhythm of your heartbeat. And then these are a couple of other methods also. I don't want to overwhelm you, but kind of let you know it does fall under this broad umbrella. Okay, so how do you learn it? Up until very recently, BCIA was the, I'm going to say only certifying body, and they are international. So, for your folks that are in different countries, they have different country pricing based on dollar comparisons and things like that. But at any rate, they provide information and they certify courses. There are other courses out there, but the ones that are BCIA approved then can count towards the certification. And there's a whole process of becoming board certified. And then more recently, the Trauma Research Foundation, which many of you know as like the organization that Bessel van der Kolk is associated with, they have also created a neurofeedback certification. And they actually do work in conjunction with BCIA. I wouldn't call them partners, but they know about each other and approve of each other. They support each other. Who's qualified to offer neurofeedback? Okay. The tricky thing is to buy equipment, you have to be licensed or work under someone who's licensed. Okay. So you can have a technician work as long as they're working under your license. You have to work within the scope of your license. Right? I mean, we all know that, but it's part of what we have to tell people. Don't do things you don't know how to do.
It's worthy to remind people of that fact. Yes. You want to stay
I can tell you there's been some folks that, have called me up and they're like, I got a person that has epilepsy. Can you help me out? And I'm like, how long have you been doing this? Oh, I just took the course. No, I'm not going to help you with that. Let's start with somebody that doesn't have epilepsy. But people get eager, right? You can't fault them for that, but you got to remind them, as you've said. Always check with your malpractice coverage, and have adequate neurofeedback training. These are just basic things you all know. It's really good to learn with the support of colleagues. If you can partner with somebody who's learning at the same time, that's great. I teach neurofeedback courses. We connect all the students together. We share everybody's emails and really encourage them to talk with each other. And then what's the process? You take a didactic course, get some mentoring, which is different than supervision. Mentoring is I'm teaching you. Supervision is you're working under my license and I'm responsible for you. Practice. We always teach people to practice on themselves first. And this is where neurofeedback is a little bit different than maybe some other therapeutic interventions. You can also practice on friends and family members. It's kind of like if you're a personal trainer, you're allowed to do personal training with family members, okay? If you're doing psychotherapy, not really recommended, right? And then continue your learning, just like you do with everything else. Take ongoing courses, workshops, practicums, and so forth. And that's a broad overview. I hope I've left enough time for questions and discussion. I think between the start that Juanita gave us, hopefully you feel like you know a little
I want
bit
to
more.
encourage everybody out there, if you have questions, to enter them in the chat box, or if you want to raise your hand, we will come to you and let you come on and ask your question vocally if you'd prefer. And while we're waiting on folks to get their questions gathered, I have one. As people begin to do this and as they get this training, first of all, how long does the training typically last? Is it just give us a little bit of a flavor of that?
Yeah. So different people do have different responses to the neurofeedback training. It's very much like, if you would say to me, I'm not that you are, but like talking about somebody who's 20 pounds overweight, how long is it going to take them to lose 20 pounds? I don't know.
Okay.
It depends on a lot of things. And the same is true for neurofeedback. So this is why I say it really is not a standalone. If you can support somebody to be getting good nutrition as much as possible, doesn't that help the way our brain works? If we're getting better sleep, that's always a catch-22. A lot of people don't get good sleep, and neurofeedback can help you get better sleep. In fact, neurofeedback was kind of founded around the field of epilepsy. Okay, so kind of a story that is just, kind of the family story of neurofeedback was that Barry Sturman was working with animals and wanted to see if he could measure the brain waves of animals and if he could change them. And so ultimately he worked with a bunch of cats, and he presented the cats with milk when their brain waves went into a certain pattern. So at that time, he literally implanted, you're not allowed to do that anymore to animals, right? You can't bury sensors in their brain, but he was able to do that 35 years ago. And lo and behold, yes, he changed their brain waves.
Yeah.
Okay. So then what happened was NASA came to Barry and said, we're having this problem. Astronauts, people that are working in the space industry, are having a higher percentage of seizures than the general population. What's this about? So Barry started exposing animals, his lab animals, to rocket fuel fumes. And they would have seizures. He could make a lot of animals have seizures, except a group of cats. So he had inadvertently trained these cats to be seizure resistant. And so what happens? People with epilepsy, by and large, have a high percentage of seizure activity as they transition into sleep, okay? Because the brain doesn't transition well. That's the problem with epilepsy, okay? It's a seizure in transitions. And so is sleep problem. It's a problem with transitions. So kind of a long way of saying the neurofeedback was discovered around sleep, and that's an important thing for helping neurofeedback. But to answer your question, finally, we tell people if you're not feeling something by 5 sessions, that tells us your brain is really wanting to hold itself in the place it's in, and we can push it harder. Gives us the go-ahead to kind of train longer or train focus. 20 sessions, they should pretty much be done. If I've got somebody with neurological damage, it could well be a year of training, couple to, like 100 sessions.
And let me ask this, Angelica, and we got a couple folks who want to ask questions, and we've got some in the chat box too, tons of questions here. But when you're doing this, do you know patterns of brain waves already? So are you able to, in other words, are you able to read people's mind, or do you have to kind of go through a process of correlating those things with things that they tell you about their brain wave patterns?
Reading somebody's mind, like reading their thoughts.
Yeah. So the question, I guess, is basically, can you look at a brainwave pattern and say, oh, okay, I kind of know what this person's thinking, or do you have to correlate that with something they've told you that they're experiencing when they're having that pattern?
Okay. So I can't ever tell what you're thinking, okay? But I can tell if you might be feeling a lot of strain, or I can tell if you're drifty, if your mind is wandering. I can tell if you're falling asleep. I can tell if you're agitated, possibly. But an overriding concept is the patient is really the most important person in confirming what's going on. So I never would say to somebody, oh, I see you're now feeling stressed. I may say, I noticed a change, and I'm wondering if you noticed a change too. Okay. Do you notice a change in how you're feeling? And they'll be like, well, what do you mean? And I'm like, well, I don't know. Do you feel as relaxed as you did before? Well, no, I was worrying about this. Could you tell I was worrying about that? I'm like, no, I couldn't tell you were worrying about that. I could tell there was a change, and it looked like worry. Okay.
That's great.
Yeah. It really, and people like the validation of that. I have to tell you.
Yeah. I can see where that could be very validating and get you in more of a space where you're able to better validate with people.
Yeah, especially people with trauma.
Right.
They feel like they've been told so much, they overreact, or they're not doing something right, or they should do something different. And it's like, well, no, your brain is being protective. It's doing something very right, but it's not helpful. It's not helpful right now.
Juanita wants to jump in here and ask a question. I think Chris also has a question.
That's a brilliant description. I do have a question subsequent to my comment here, but I'm thinking back to our session last month with Dr. Margaret Newberry-Jones, and we spoke about regulation. So particularly emotional regulation, I can't help but think how much this ties into helping somebody understand how to regulate and supporting them through the process of achieving a level of regulation they may not have been able to achieve previously. So I'm just thinking of the so many practical applications, particularly for PTSD, trauma, all of those, and any regulation issue. But that's phenomenal. And I do have a question, and I saw that that's a question that's echoed in the chat a little bit. Wondering if you can share, obviously anonymously, an example of a person you worked with through a process of neurofeedback.
Yeah, there's a lot of them. Well, I work with a lot of folks that are adopted. We're not far out of Lancaster, Pennsylvania, which a lot of people know as like the Amish center of the country. But what I didn't know for a long time, it's also the adoptee center of the country. Lots of adoptions happen there. There's lots of adoption facilities. And these are adoptions, there's so many varieties. I mean, people will come and say, oh, we adopted him at birth, he's fine. And I'm like, well, he's lucky, but he doesn't feel the rhythm of his mother's heartbeat. He doesn't feel the cadence of her walking or hear her voice. And those are big changes. Okay. And then let's even get into what happened, that the mother had to give the child up. That's a whole, other story. What trauma did the mother have that she had to give the child up? Okay. But then we get people who are adopted from, like, left in a park in a basket in Russia. And somebody found them and brought them to the adoption agency. And then they lived in the agency for 2 years till a family came and got them. And we know during those 2 years, they weren't getting the care that a child should have. So I have a fellow like that coming in, and he's just overwhelmed with intensity. Like, just even talking about how resilient he is reduces him to tears. He just becomes overwhelmed. And so he's, lots of times people that come here have been to all kinds of talk therapy. They've been to, IOPs, they've been to residential treatment facilities, they've been everywhere. And we're kind of like the last hope, so to speak. Well, we'll try neurofeedback, nothing else worked. But what we are doing with him is just some very basic training. And the plan is, ultimately, his mom is a businesswoman and she's very capable. He's 21. And we're working with them that ultimately she's going to do the training at home so that he can even feel more comfort. And when we're working with adoptive children, he's an adopted child adult, our process is, it's most important that you make that connection with the primary caretaker. So we really involve the parent. The mom is already doing the hookup of the sensors on him. We don't say, you're doing really good. We'll say things like, your mom's seeing how good you're doing, and I want her to tell you how she likes this. So we become unimportant, so to speak. Okay. And that's what I tell my clients. I tell them, look, I know how to work the equipment. I know how the brain works. The most important person in the room is you. You have to tell me, like, can I keep going? Do I need to stop? Okay. You have to be able to tell me that. In order to start this, you have to be able to give me the go ahead or the stop. That's what I require of you. Okay. You have to say, I don't like it. Okay. But I want to limit, as you can talk as much as you want, but those are the basic requirements. So he'll be coming in. We also just did a nutritional analysis on him. We have this fantastic neurological chiropractor out of Denver that we refer to. We send the blood work there. And we work in conjunction with this fellow's psychiatrist and his therapist, all working on the same goals, which that's a key thing. Let's all have the same goals and go at it from every which way we can. Okay. His first goals are to be able to take a supplement. Okay. we want to get him some kind of nutritional supplements because he doesn't eat well. And if you can't eat well, you're not putting gas in the car. How's the car going to run?
That's right.
Okay. But we'll probably see him for 20 sessions, teaching his mom along the way, and then we'll give them loaner equipment and they'll go and do it at home. And we'll keep track of it, doing regular appointments. You know, pandemic's been great for stuff like having this kind of a meeting. It's also been great for doing homework, you know, directly working with people while they're at home. So.
Chris White had a question a little bit earlier. I'm not sure if he still has it or not, but I want to give him the opportunity.
Bruce, your question actually, when Angelica was answering yours, she got around to answering the one I had.
Okay. All right. Very good. Thank you. Babs, we have some questions from the chat box.
We do. So one is, you kind of answered that one. I'll move down. Do you find a lot of Medicaid providers offering this or mainly private insurance?
Yeah, good question. There is an initiative out of California, the Neurofeedback Advocacy Project, and they work with Medicaid providers. Largely in California, but they just started a project in New York City schools as well, working with Medicaid. I personally have, I have a psychiatrist that I've known for a long, long time, and she runs she's the psychiatric director at a children's facility, an inpatient treatment facility, and she's been able to get Medicaid to pay for a few select residents there, and they literally bring them to our office. But her long-term goal is to show them that we're able to do what we say we do, and then to get them to cover it in the facility. And she's being fairly successful in that. I actually have a meeting next Monday with the managed care organizations that are in the three local, in Pennsylvania, managed care is managed by county. So I have a meeting next Monday with the three managed care facilities from the three local counties that refer to that hospital. So the interest is growing. There is no billing code for neurofeedback. There's no CPT code for neurofeedback. And that's a thing that's being worked on. So of course, if you're billing, you have to bill to the highest level of specificity. So right now you bill that as psychotherapy or biofeedback. There's some complexities to that billing. I'm not going to get into that here. But to answer you, there's not a lot of medical assistants working with it, but there is a real drive to change that. There are some real strong initiatives going on to work on that.
Okay, another question we got is, how would you recommend people find local providers for this service?
Okay. Go ahead and put my name in the chat. If you know, Angelica@sadarpsych.com, you can write to me. But if you also put in bcia.org, they have a list of certified providers. Okay. Now, that means they've gone through the BCIA training. That means they've done a certain number of sessions of mentoring. They've passed a test. They've met certain requirements, right? I mean, we've all been to a physician that has an MD degree that we didn't like. So you still have to be a good consumer. And I will say there are also neurofeedback providers that are not certified that are very nicely qualified. So looking at BCIA can be a first step. Talking to people, it is funny. People do neurofeedback. Every neurofeedback practitioner I know has a waiting list. Nobody is looking for patients. We're packed. Okay, so people are coming and they talk. Psychology Today is another place you can look up. Sorry about that, Bruce. Psychology Today, and do a search on neurofeedback.
And I assume your practice is broad. So you may serve some people with IDD, but you serve also typical people as well.
Not so much anymore because
Okay.
we just don't have the bandwidth to take care of
Okay.
everybody. And
Okay,
so
gotcha.
it's kind of like anybody that comes here is pretty complex. If you're just like I used to do a lot of peak performance. I've actually worked with professional sports teams. And now if somebody calls up and they're like, my daughter wants to play better tennis, I refer them somewhere. They don't even come in, because we're going to take the people that really have complex issues.
I see. Okay. Babs, other questions?
Yeah, that kind of goes into the next question. So we got questions. Would neurofeedback be helpful for people with addiction, PTSD, or autism spectrum disorder?
Yes. When I first started neurofeedback, I had a friend, like I said, I did a lot of my first kind of like entry with neurofeedback was with professional tennis. And I worked with somebody who did a lot of tennis stuff. And she's like, you just sound like a snake oil salesman. Like you say it works with everybody. I'm like, but the brain, like everybody's got a brain. Physical therapy can help anybody, can it? I mean, by and large, right? Everybody wants their brain to be better. Anybody can benefit from a personal trainer. Like you might be in good physical health, but hey, you can get better. So autism, again, those might be folks that can't communicate very well. Okay. And so it's a great intervention for them. PTSD, again, if you follow like Bessel van der Kolk, he's like, don't even work with PTSD unless you're doing neurofeedback. His organization has developed a whole neurofeedback component. So it really can be helpful for almost anybody.
One final question, Angelica. Can neurofeedback be helpful at all with sleep?
Well, that's what I was saying earlier with Barry and the cats and the seizure resistant cats, right? Very often, the very first thing it helps is sleep. And isn't that amazing? Because if you can sleep better, you can function better in the day.
Right.
And so many people have sleep problems. Now I'm going to say one quick thing. When you're working with that, a lot of people have sleep problems now because they also have screen problems. Okay. And so you gotta work together. You can't be like, okay, the neurofeedback is going to let you be on the screen for 8 hours a day.
Right.
Okay.
Yeah. All right, good stuff. This is so interesting, such important stuff as well. And I think such an area that people who work with folks with IDD need to be considering more and more than we have in the past. It's just great stuff. Thank you so much, Angelica.
My pleasure. Thank you for bringing the topic and bringing me. And thanks, Jean and Nad, and everything you guys are doing with us.
Love that collaboration we're doing. That's wonderful stuff. And thanks to my co-host, Juanita St. Croix. Appreciate you being here today. Babs Tierno, of course, always. And again, Angelica, appreciate you being here so much. Jean, so glad you could join us. And we will see you again next week on the Clinical Consultation Network. We do it every Tuesday at 12:30. Of course, our fourth Tuesday is our NAD feature, and we'll be having Dan Baker on here for our next NAD feature. So look forward to seeing y'all back here next week.
Wonderful. Thank you,
everybody. Bye.
Bye, everybody. Thank you, Angelica. It was fantastic.
Pleasure. Nice to see you.